just going to break into networking, and we're going to have as a prompt question just that first question we put up in this morning about just to explain it to you. I mean, in the American Rescue Plan, there is something around $250 million that is going nationally to community-based child abuse prevention program work. We are the recipients of that grant in Idaho, and we'll get about what looks like a little over $1 million that we can spend over the next couple of years to enhance our work around prevention. So that's the prompt question. If you want to talk about that, that's great. If, on the other hand, you get into a group and you feel like, darn, I just want to talk about what I'd be talking about if we were standing around the coffee pot or eating lemon bars or whatever it is we do this time of day at a conference for real, feel free to do that as well. I would be interested to know what people think about this $1 million question, but again, I want to give you the freedom to have your conversations however they develop. So we're just gonna go ahead and do that. I think the plan, let's see, I'm trying to remember what the plan was exactly on this. I think we were gonna go for a long period. So we're just gonna go for 20 minutes or so, give people the opportunity to just talk with each other about, again, either this subject or, anything else. You can talk about your workshops, talk about where you're at, all of that. So Austin, you wanna go ahead and pop up those breakout groups, and then everybody can jump in and join. Tell everybody what they need to do, I guess.
Yeah, so I'm going to go ahead in just a couple of seconds. I'm going to open up all the breakout rooms. You'll get a notification on your screen that says you're being asked to join room number whatever. Just click yes. If you don't see that notification pop up, once I open the rooms on the Zoom toolbar, you should see either something that says breakout rooms or something that says more. If you click on more, it'll give you breakout rooms, or just click on breakout rooms, and then it will tell you what room you're supposed to be on and click yes. If you are calling in on so not using the Zoom app, but you actually dialed a phone number, I'm not going to automatically put you in a breakout room just because I want to make sure that if anyone is calling in separately on their phone for the audio and their computer for the video, they don't get sent to two different places. So once we've sent everyone to the breakout rooms, anyone who's calling in on a phone, I'm going to say the phone number, and you can tell me what your name is, and I will assign you to a room. All right, so we are opening the rooms now.
We have a Michelle that's just getting on.
Okay. Looks like whoever was called in on a phone is no longer with us. So everyone should be going to breakout rooms. If you're having any issue, if you're still in the main room now and you're having any issues accessing those. Oh shoot, I did not pull Tabor, Tamron, and out.
They can leave.
Okay. Look at that. Everybody went to their breakout rooms.
No, I think a session actually just closed.
Okay.
Shoot. So.
Are you there? Can you hear me this time?
Yeah,
Hello?
we can hear you.
Oh.
Roger, are you muted, or are you with us?
Oh, I am muted. I am here.
All right, we've got everyone back, so we're good to proceed.
Okay, so and where are we back to? Are we back to the main room, or where?
We are in the room that I think the next thing we have on the agenda is self-care, which is in this room, and then we will move into the other room for the panel after self-care.
Oh, okay. Okay, good. I was confused.
Yeah, Cam is getting.
I'm sorry, losing my set of schedules here.
Yeah, Cam's getting the panel presenters ready in that room, so we'll do self-care in here.
Okay, Kristen, are you with us? What did anyone have any conversation about? I'm going to see if Kristen's actually here. I don't see her.
I think there was a lot of confusion between this room and the main room. She might be over on the main link.
Okay. Did anyone have any conversation about the you know, if I had $1 million discussion? Did you have any ideas for what we ought to be doing? And I see Jennifer nodding her head. So tell me about it.
I'll start, Jennifer, while Jennifer's getting there. We talked about doing prevention, more mental health in the schools. Also, several years ago, a lot of services were taken away from our rural communities, put services back into the rural communities. That was a few of them.
We talked about how Idaho, in our group, how Idaho, we're looking at, you know, preventing child abuse and stuff. And it's like, we can't even really work on that because we're stuck just trying to meet daily needs. Like we talked about how housing is just huge right now. In our northern Idaho area, we're seeing a large population, more this year than last year, because I work for North Idaho College Head Start, of homeless families. And so our homeless population has increased because of the increase in rentals, and it's pricing people out of even the lowest income. Rentals are ridiculously expensive. If you try to buy a house, don't even bother because they're snatched up before they're even looked at. They're buying everything sight unseen, renting things unseen. And we just have such a huge influx right now of out-of-staters moving to our area because it's such an awesome place to live. That it's really hurting the locals. And so we have, I was saying that we have a family right now, there's 9 of them, and they got ousted out of housing, and they're living in living with their in-laws in a 2-bedroom house. And that's just a family of 9 with 2 more adults in the house, you know, the grandma and grandpa. So as you can imagine, stress in that family is ginormous. You know, those are the things that we're facing is housing is a huge crisis right now.
So how would you deal with it? I mean, it's, you know, that, you know, one, our $1 million is, I mean, there's going to be rental assistance money. But, you know, again, it's, you know, not, yeah. What would be what do you have any thoughts about what would be a short-term fix, or excuse me, something that would help set a foundations for changing that? Because this is what I think we got to get to, right?
That's a hard one because we don't even have enough housing. That's the problem is everything's full and nobody's moving around because, you know, if you're going to buy a house, the best way to do it is to go to one of the housing developments and get on the list for their building, which is like a year out. They're so backed up in here because we have such a huge influx of people moving to the area. It's a crisis, really. And I don't have answers for it. I wish I had an easy answer for it. But what do you tell someone who's on a fixed income, you know, and they can't even afford, you know, our rents equal the amount of a mortgage payment. You're paying $1,200 for a 2-bedroom, 1-bath apartment in a crappy neighborhood. So what do you tell a family? You know, they can't afford it. So they're going home to live with relatives, which is causing stress, anxiety, CPS cases to go up. You know, we're able to, our community is amazing. We're able to provide food and clothing without problems. No problems with that. It's the housing that's really just getting us.
Right, and this is happening all over. I mean, this really is a problem all over. You know,
it's a crisis in Idaho.
It is.
It's a crisis, unfortunately, in all the growing states. I think it's, you know, you have places like, I don't know, Detroit, Pittsburgh, other places that have lots of housing. And you know, the communities are shrinking, and then you have places like here where everybody's coming, and we're trying to deal with, you know, having housing shortages. It's really a problem. So I'm going to read a few things. Tara says more training availability for children, child advocates, and volunteers. we also, Brenda Stanley says, we also spoke of helping underserved and smaller organizations that have been hit hard due to COVID. Ashley says trauma training in schools for teachers and staff. And Tara then talked about kind of responding to the buying a home, that, you know, that buying a home may never be an option for a lot of people. And then Tabor says, fill out your evaluations, which, you know, I want to reinforce here too. I was recently told by my son that his friend was renting an apartment for $1,600 in Nampa, and it's 2 bedrooms. Yeah. Yeah, I think just the housing crisis, you know, throughout the state is really high. You know, one of the things that I've, you know, been talking to some of our partners, because there's money from a variety of sources that's going to be available, is that some of it is how do we figure out how to connect a lot of this together so that, you know, that we don't separate out everything like our $1 million, you know, and there's all this, there's a bunch of childcare money, like $225 million of new childcare money. Well, how do we build that in? There's rental assistance money. I can't think how much, you know, there's probably $1 million or so available for home visiting. Well, how do we figure out how to make that actually work in a way that, you know, that brings together that, you know, that new capacity that we're going to have for not forever apparently, but, you know, for a while, and, you know, figure out how to use it. Because I think that's really, you know, there are really some opportunities to do it. Head Start's got $1 billion coming from at the federal level. I don't know how much it is at the state. So there's going to be new Head Start money. So how do we take all that and use it to really make a difference for families? You know, because that's really what, you know, what we want to be about.
So Roger, this is, are you taking comments?
Sure, no, of course. You know, people are writing stuff, so I was just going to read some stuff. But you go ahead. You're talking.
So I mean, it's just been interesting from my perspective how this is going to filter down throughout all communities that are struggling, from our smallest communities that are experiencing these struggles to our more urban communities. And I think one of the things that unfortunately we didn't get to do it here in Eastern Idaho as progressively as we wanted is having groups come together from the community expressing and talking about where the challenging spots were for their community, what the biggest needs were. So for example, in American Falls is the biggest need educating people about protective factors, whereas in Bear Lake is it talking to people about, you know, getting them into housing and supporting them during those times. So one of the thoughts that I had is how are we going to, you know, maybe create some local community capacity to talk about these challenges. So that way, when we're looking at where funding is and where funding can go, it's bringing the community together to make a plan versus trying to make a plan and then involve the communities, whereas that might not fit the needs that they have. And then there might not be the money to meet the need that they have. So kind of bringing the communities to say like, hey, what are the challenges? How are we as a community going to address this? And how can we take the science that's available for our state and the understanding of what our families are going through and actually put it into action in each corner of the state, each area, each community?
Okay, well, we are ready to break and to go into the main room. So, so Austin, if you pop that link into the chat so everybody could jump into that room, and there's a bunch of people waiting there and we need to get started. So let's do it.
Hey, Roger, I probably took too much time.
What's that?
I probably took too much time there.
You didn't take too much time. You're fine. That was, if anybody's supposed to stop it, it's probably supposed to be me. So don't.